So, hi everyone. Today our group would like to present and talk about the obesity. Before we start, let me introduce our team member and their responsibility for this talk. First is me. My name is Bong Sang-ju and I will be the presenter for the intro. Queenie is dedicated for causes of the obesity. For the part of the effect, will be Chin Ping and Fang Xiuhui, while Winnie So and Lau Kyung will talk about the treatment for the obesity. So, what is obesity? According to WHO, obesity is abnormal or excessive fat accumulation that presents a risk of health. A BMI over 25 is considered as overweight, and over 30 is considered as obese. Let me share two simple methods on how to measure your body fat. First is BMI, a measure of body fat based on your height and your weight that applies to adult men and women. Next, another method is waist circumference. It is the simplest and most common way to measure abdominal obesity. So how to measure it? First, you need to stand out straight and exhale. Wet the tight measure just above your hip bones. Hold tape measure flat against body, not too tight, and take a reading. Next, according to the statistic of the 2019 NHNX findings, it shows a rising trend in weight gain among the adults, women, and people those aged 55 to 59, and also children. So we can clearly see that the obesity and overweight rates remain high in Malaysia. Next, in February 2020, the WHO stated that obesity has reached epidemic proportion globally, with at least 2.8 million people dying each year as a result of being overweight or obese. Next, I would like to add on the reason why we choose this topic. It's undeniable that the topic about obesity is very common and seems to be a bit boring. So why we choose this topic is because obesity rate among both adults and children has increased dramatically during the COVID-19 pandemic. During the MCO period or before the MCO, all of us are advised to stay at home, self-isolate, and maintain physical distancing. The pandemic led to school closure, disrupted routines, increased level of stress, and less opportunity for physical activity and proper nutrition, leading to weight gain among the children and adolescents. And also, for your information, having obesity increases the risk of severe illness from COVID-19. Having obesity may triple the risk of hospitalization due to a COVID-19 infection. And there is a quote from Jen: obesity affects every aspect of a people's life, from health to relationship. Therefore, we are here to raise your awareness, to improve your understanding of obesity root causes, serious effects, and the actions needed to address them. That's all from me, and I would like to pass to the next presenter, Queenie.
Hi everyone, my name is Queenie Q. Si Hong. I would like to talk about the causes of obesity. Next. The phenomenal increase in the level of obesity among the people can be attributed to unhealthy eating habits. Nowadays, more and more people tend to eat out at restaurants and fast food outlets such as KFC, McDonald's, Subway, Mary Brown, and so on. As we all know that consume the food high in calorie and fats such as French fries, burger, pizza, and noodles, and others that can cause the obesity. A result found that the fast food contain more calories as a single meal at a fast food outlet provide a person with the total numbers of calories he needs for an entire day. Calories in our food and drinks gives us energy. We use the energy up when we are active. If we take in more calories when we burn off, the extra calories are strong as body fat. Furthermore, consuming too much sweetened juice, carbonated drinks, and alcoholic drinks which contain a lot of calories with no nutrition benefits can lead a person to obese. Moreover, people also turn to prefer processed food over fast food. It's undeniable that eating too much of this food and doing too much exercise and too little exercise can result in overweight. Next. Today, as a result of technological advance and convenience, we turn to be inactive and live to sedentary lifestyle. A sedentary lifestyle can be linked to a greater risk of obesity. Some examples of sedentary habits like working in an office rather than doing normal work level, or going to the place by car instead of walking or cycling. Not only that, spending hours in front of the television and playing games instead of doing activity outside. As a result, people are not active enough to use out the energy provided by the food they consume. Besides, the many conveniences which are available, such as elevator, cars, and internet, reduce the level of the physical activity. The lack of physical activity means fewer calories are being burned and lead to weight gains and obesity. Data from the Center for the Disease Control and Prevention show that obesity rate tend to be highest in the area where adults report no physical activity in their leisure time. Next. Recent hypotheses in the scientific community suggest that the current obesity epidemic is being driven largely by the environment factors. The world around us influences our ability to maintain a healthy weight, such as not having area parks, sidewalk, and affordable gyms that make it hard for people to be physically active. Besides, oversized food portion increase the people calorie intake, which make the people even more physical activity needs necessary to maintain a healthy weight. Apart from that, food advertising improve the use of persuasive technical and strategy to shape and influence the people's food attitudes. It encourages the people to buy unhealthy foods such as the high fat snack and sugaring drinks, and it is tough for individuals to make the healthy choice. That's all for me. Next, I would like to pass to the Qing Ping.
Hi, my name is Qing Ping, and now I will talk about the effects of obesity. Next. So one of the effects of obesity is encourage laziness in society. It is doubtless that obese people usually find it difficult and strenuous to move one point to another because of accumulated fat. Walking or jogging for people with heavier weight is a thing that can hurt their knee all the time, as their knee cannot afford their weight. In mathematical terms, every pound of excess weight put approximately 4 additional pounds of pressure on the joints. This means a person who is 100 pounds overweight put an extra 400 pounds of pressure on his knee, hip, and ankle with every step forward. This kind of extreme force causes a rapid deterioration that can lead to significant problems later in life. Besides, obese people usually feel hard to breathe when they just walk for a while. Having excess abdominal weight may lower one's lung function regardless of a person's age or smoking history. Excess fat can constrict the lungs, making it harder to breathe, and more oxygen must be moved around for the excess tissue. This causes the heart to work harder and place a greater burden on the cardiovascular system. Therefore, it is more difficult to breathe when someone is overweight and causing them inactive in sport. Next. So, in general, obese people perceive exercise as punishment, which makes them more painful. Therefore, they prefer not to accept simple activity like jogging. As a result, most obese people lead to a sedentary lifestyle, which is usually characterized by minimal or no movement. Based on this sedentary lifestyle, obese people spend a lot of their time watching television, movies, and playing video games, which worsens the situation. In such scenario, obese people prefer being helped to do basic activity, including moving from one point to another. In short, obesity will encourage laziness among people, and laziness will make them become inactive and productive. Next. So another effect of obesity is making people depressed. What is depression? Everyone feels blue at times, but depression is feeling low for extended periods. Depression can cause serious symptoms that affect how you feel, think, and carry out daily activities such as eating, working, or sleeping. These symptoms must be present for at least 2 weeks for you to be diagnosed with depression. Depression and obesity are two common conditions with major public health consequences that frequently co-occur within individuals. The relationship between these conditions is bidirectional. According to the research, obese persons had a 55% increased risk of developing depression over time. People who are obese experience many different social, mental, and lifestyle issues that can lead to depression. In today's society, obese people usually become the target of being teased or ridiculed. Next. In some cases, people who become obese lose their friends and may get disapproval from teachers and other personnel. In extreme cases, obese people may not be considered for promotion at workplace because of the negative perception held against them. This is actually a discriminatory behavior and should not happen in any company. Problems with body image and social isolation can easily permeate an obese person's life. Being overweight can be a significant cause of dissatisfaction, sadness, frustration, and even death. Apart from that, extra weight can also cause chronic joint pain, which inhibit obese people's ability to get around, enjoy life, or exercise. All in all, this scenario will make obese people depressed. Now I will pass the presentation to the next person.
Hello everyone, my name is Pham Siu Hui. I will proceed the webinar with another 2 effects of obesity. Next. The first one is obesity will lead to other serious health issues. The second one is obesity will cause a person to have lower self-esteem. Let's go through these 2 effects one by one. The first one lead to other serious health issues. Next, we have 3 common serious health issues that are related to the obesity, which is which are coronary heart disease, diabetes, high blood pressure. I will explain to you all these three one by one so you will know better why these three are related to obesity. Next. Coronary heart disease. According to medical news today, coronary heart disease develops when the coronary arteries become too narrow or cholesterol blockages develop in the walls. The blockages reduce the blood flow to the heart and oxygen cannot be supplied to the heart effectively. Without proper care, coronary heart disease will likely lead to heart attack. An obese individual has an 81% higher risk of heart disease and 64% of stroke. According to the Centers of Disease Control and Prevention, approximately 655,000 people die every year due to heart attack in the United States. Next. Diabetes. According to the World Health Organization, diabetes happens when the pancreas does not produce enough insulin or the body cannot use the insulin it produces effectively. A person has diabetes when they consume too much consumptions in their diets. There are two types of diabetes, which are type 1 diabetes and type 2 diabetes. Type 2 diabetes is often related to obesity as it happens due to excess weight or physical inactivity. It has been proven that 30% of type 2 diabetes patients were clinically obese. Uncontrolled diabetes can damage the heart, blood vessels, eyes, kidneys, and nerves. Next. High blood pressure, or also known as hypertension. Blood pressure is the force exerted by circulating blood against the wall of the body arteries, while high blood pressure happens when your heart works too hard to pump blood throughout your body. People have high blood pressure because of poor diets, such as excessive consumptions of salt, low intakes of fruits and vegetables, along with physical inactivity. Therefore, regular checkup on your blood pressure are really recommended as hypertension may come without warning. Hypertension will also lead to kidney failure, stroke, and sometimes irregular heartbeat will lead to sudden death. Next. Let's proceed with the second effect, which is lower self-esteem. Next. People with obesity, also known as obese, often came out as lack of confidence. Due to their body size, they became the victim of bullies at school or work. This constant body shaming caused them to be afraid of going out, trying new activities, or even socializing. Instead, they choose to shut themselves down from the outside world, which will then affect their mental and emotional health. These long-term conditions will lead to depression and anxiety. Hence, people with poor mental health often overcome their problems by doing drugs, drinking alcohol, smoking cigarettes, or even overeating. These actions will then worsen their physical and mental health. That's all from me. I will pass the webinar to the next speakers, Winnie.
Hello everyone, my name is Winnie So and I am today's speaker 5. As what speaker 2 said at the beginning, at the point living is sedentary lifestyle. Lack of physical activity is also the vital factor cause to obesity. Effective manner to overcome obesity, we need to exercise regularly. Next slide. Before I explain more detail, let me ask you guys a question. Can you guys put your answer in the chat box? Do you do exercise at least 3 times in a week? From the chat box, I noticed that more of the people had no do exercise at least 3 times in a week. Of course, we are university students and difficult to find time to exercise because we have a lot of assignment, quiz, lecturer, presentation, and tutorial. Workers also think that difficult for them to find extra time to exercise because having a lot of workload. This behavior is not good. Please do not practice. Having a lot of assignment as a university student and a lot of workload as a worker is a normal thing. Learn to be organized and systematic. Take example for me. I also university student and had a lot of things need to complete. But I always discipline me to exercise at least 3 times in a week. Next slide. It is advised by the doctor that we must do exercise a minimum of 3 times a week and as much as half an hour at once. Next slide. Next, I will explain how exercise can prevent obesity. Firstly, exercising can increase people's total energy expenditure, which can help burn excess calories or fat in the body. Second, exercising can decrease fat around the waist and total body fat. This can slow the development of abdominal obesity. Next slide. Next slide. Next, I would like to highlight what kind of exercise can we do. Does jogging suitable for all the people? Of course, jogging is an exercise useful for our cardiovascular health. But jogging needs a lot of preparation, like prepare the water, small talk, shoe, find a good place, and do a warm-up activity before jogging. And after jogging, we need cooling down our muscles for 5 to 10 minutes to prepare lactic acid build-up, which can be painful. This all preparation requires a lot of time. Since almost all the people have time constraints, so jogging is exercise can be said that it is not very suitable for busy people. Next slide. Swimming. Swimming as an exercise is popular as an all-around body development, and it is particularly useful in therapy. Swimming is a great workout, can burn a lot of calories because swimming requires to move whole body against the resistance of the water. Swimming also like jogging need a lot of preparation. Besides, need to make sure know how to swim. Next slide. Aerobic is aerobic exercise. Does aerobic exercise is suitable for all the people? Okay, let me explain to you guys more detail. Aerobic exercise are fat burning exercise. If you continually do aerobic exercise, you can see visible benefit within a month. Everyone can practice aerobic exercise at home to lose weight and take fitness journey to the next level. Next slide. Below is an example of aerobic exercise can do for weight loss. Skipping, jumping jack, and mountain climber, dunking kicks, boulder kick, and board jump. I think aerobic exercise is more suitable for people, especially who busy with their work, because this kind of exercise can be done at home at any time. Actually, there are no exercise more suitable for all the people. It depends different people. So find the exercise more suitable for you according you prefer. Next slide. We should not use the beginners of work as a reason not to exercise. If busy allow with care until time consent to exercise activity, then at the point you can try to do activity can make you move. For example, assuming you frequently take the elevator at work, you could attempt to climb stairs. Apart from that, you also can attempt to lift the car somewhere farther away so then you can able to walk often. It's clear that continually doing exercise activity is determined as a daily culture to prevent obesity. That's all for me today. Now I will pass to next presenter to continue their part.
Good morning to everyone who is watching this webinar. My name is Cont'd. Now I am going to show the treatment of solving obesity. Obesity is frequently treated with a combination of healthier diet, increased physical activity, lifestyle changes, and weight management programs. However, there are certain individuals who are obese and unable to lose enough weight to improve their health or to avoid regaining weight. In such circumstances, a doctor may recommend additional therapies for them, such as weight loss medications or bariatric surgery. Within the first 6 months of the treatment, experts recommend the one who is obese to reduce their body weight around 5% to 10%. For example, if you weigh around 90 kilograms, that means that you just need to lose as little as possible, like 4.5 kilograms. So, losing around 5% to 10% of your body weight may be beneficial to contribute to lower your risk of developing health problems which are associated with being obese, such as high blood pressure or high cholesterol level. And when a good diet and physical activity habits are insufficient to treat the obesity, your doctor may prescribe medication to help you to lose weight. And while you are taking your weight loss medication, you should also try to maintain a healthy eating plan and regular physical activity. You may come across with some advertisement for herbal cures and dietary supplements that promise you to help in weight loss. However, many of these advertisements are false and incorrect. Several of these supplements have the potential to cause major negative effects to your body. So, asking your doctor before you are trying to lose weight by using herbal medications or dietary supplements. And bariatric surgery encompasses a variety of procedures that help in weight loss by changing your stomach digestive system. In doing so, you just only need to eat some food, and then your stomach will fill out quickly because your stomach gets smaller after the surgery. And if you are extremely obese or having major health issues, such as type 2 diabetes, bariatric surgery may be an option for you. And then your doctor may also recommend a lower calorie diet of 1,200 to 1,500 calories per day for women, and 1,500 to 1,800 calories per day for men. The calorie intake is determined by your body weight and the level of the physical activity. A low-calorie diet that includes a variety of nutritious meals can provide you with the nutrients you require to be healthy. And then this one. Intermittent fasting is another method of calorie restriction, but this kind of restriction is not encouraged for everyone. It's because that there is no guarantee that intermittent fasting is safe or beneficial for a long time. Of course, you can skip your dinner sometimes, but it's not good for long term. If you do this frequently, your stomach will get hurt. So it's better that you eat as little as possible and avoid from not eating anything just because you want to lose your weight. And in conclusion, during this webinar, you have learned about what is the obesity. You have learned about how to calculate your body mass index. You have learned about what is the causes, what is the effects, and what is the treatment of the obesity. And that is all from us. Thank you for watching our webinar today, and have a nice day.